I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. We have someone with us today that I'm really excited to talk with, Dr. Susan Havercamp. Welcome, Susan.
Thanks, Craig.
So I've quoted your research a lot of times, and I remember before I got to know you, I was like, oh, who's Susan Havercamp? And now I know you, so this is fantastic. Tell us a little bit about what you do in this field, in particular the research.
Thank you. My main concern is the health of adults with intellectual and developmental disabilities. So my research has focused on health disparities, on including adults with intellectual and developmental disabilities in research so that they can fully participate and provide their own report on their thoughts and feelings, and also on training healthcare providers to better meet the needs of people with disabilities.
Well, you and I share a lot of those concerns, because my big thing is, you know, if you've listened to this before, is about training healthcare providers to be able to meet the healthcare needs of people with intellectual and developmental disabilities. So you're out of Ohio, right?
I am.
Tell
I'm
us
at the Ohio State University.
Okay. Neisinger Institute?
The Neisinger Center is a university center for excellence in developmental disabilities.
So the USED, as we like to call it, right?
Yes, we do.
Yeah, excellent. So what are some of the specific things that you've researched, or some of the findings maybe that you'd like to share related to the work you've done?
Yeah, thank you. So a lot of my research has looked at the health and healthcare outcomes for adults with intellectual and developmental disabilities. And one thing that was surprising initially was that we don't have as much data as we'd really like to have to document the health problems and experiences of adults with ID, because it's difficult to identify them in the health research that we have. There are large national and state level surveys of health, and that's how we get most of our health information and how we prioritize the health goals for the nation. But it's not possible to identify adults with intellectual and developmental disabilities in those studies because we don't ask that question. So I guess some of my research has been on trying to find the data that we need, trying to add questions that can be used to identify people with intellectual and developmental disabilities in these health surveys, so that we have more data to document disparities and to shape future research priorities.
So let me ask you, is it as simple as asking on a questionnaire, do you have an intellectual disability, or do you need more information than just that?
You know, that would be a good start.
That's a simple start.
That would be a really good start.
So it's really not that hard to add let me back up. It's not that it can be hard to add questions to some of these things, but it's not complex questions that we're really needing to be added, right? Yeah.
We tried adding a question in an Ohio survey, just do you have a developmental disability? Just to see how people would respond. We were worried that people might, because of stigma, be reluctant to admit to having a disability. We were worried that maybe the term developmental disability wouldn't be well understood, and we'd have people endorsing that or saying, yes, I have a developmental disability because they had anxiety or a learning disability in school. What we found was that only about 4% of the population endorsed the item, which is pretty close to what we would expect for the population of people to have.
Meaning answered affirmative that they'd had a developmental disability.
About 4% of people said they had a developmental disability, which was about what it should be.
Yeah. I've seen different percentages, but it is somewhere around 3-4%.
Yep. And then we looked at the other questions that they answered, and we found that most people who said, yes, I have a developmental disability, also had other significant health conditions, also had Medicaid for their health insurance carrier, and some other signs that led us to believe that we were probably reaching the people that we were hoping to reach. So that was encouraging, because it was just a one-item identifier. one thing about adding questions to surveys is that it's very, very expensive, hundreds of thousands of dollars, because it lengthens the time of the survey.
Wow, I never thought about it that way.
Yeah.
So just to add a couple of questions can mean a lot of money.
It's a lot of money.
Wow.
Yeah, so you really have to make a case that it's important and that the questions are going to work. And so, fortunately, right now, the Administration on Community Living, which is the federal agency that's responsible for health and human services for all intellectual and developmental disability services, they've been really concerned about the problem of being able to identify people with intellectual and developmental disability, to know about their health, to know about their community living outcomes, and they've been working to add questions to national surveys. And we've got a program called IDD Counts that we have an IDD Counts website that tells you more about our 10-year plan to try to improve health outcomes and the visibility of people with intellectual disability.
So IDD Counts, is that the website? IDDCOUNTS.com, org? I'm
going to have to get back to you.
Okay, one of those.
It's one of them, and I can definitely...
it's one of those, okay.
Yeah, sorry.
All right, no, if people want to get more information, look up IDD Counts.
Yes.
All right. So you've worked on some big initiatives in your career as well. Some of them related to competencies.
Yes.
Competencies, or just talk more about that.
Yeah, sure.
Yeah.
So I'm a member of a not-for-profit organization called the Alliance for Disability in Healthcare Education. And it started off as really a small group of health educators who were worried about the healthcare quality for patients with disabilities. And we were each working in our own respective institution trying to improve healthcare education. And one thing we realized just in talking amongst ourselves is that we all had been able to add content to the medical curriculum, to the nursing curriculum, to OT, but it was all different. Some people were adding lectures and talking about etiology of disability. Other people were trying to arrange for home visits or bringing people with disabilities in as teachers. And we realized that we were trying to teach different things. We had different ideas of what the goal of the intervention was. And so we decided to come to a consensus on what is important for healthcare providers to understand about disability in order for them to provide quality healthcare for patients with disabilities. And so I led a Delphi study where we recruited a lot of people with disabilities and caregivers of people with disabilities, family members, other stakeholders, as well as health educators who had disability expertise. And we asked them, what's important for students to learn, what's important for healthcare providers to know. And we kind of refined a list of competencies, which are the things that you have to understand and should be taught then in healthcare education. And so it went through an iterative process where we refined it, sent the list back out to people until everyone agreed. We had a 95% agreement that the list of skills, attitudes, and behaviors captured what healthcare providers needed to know in order to provide quality care.
Can you touch on some of those?
Yes. So there are 6 competencies. I won't be able to list them all, but there are things like understanding the social model of disability and not exclusively seeing disability as a medical condition.
And I'm going to stop you there, and I want to elaborate on that just a tad. So one of the things when we talk about health care for people with disabilities, sometimes people automatically think you're talking about the medical model, which is where you see the disability as a medical problem and that needs to be fixed. Mm-hmm. The social model is looking at the social construct of the world and how people with disabilities basically just have differing abilities, and we should create an environment and the social network to be able to support people of all abilities. Is that a fair?
Yeah.
Yeah. And healthcare fits into that in my view, because everyone should have access to competent and compassionate healthcare, and that includes people with disabilities. So I just want to make that point that we're not confusing healthcare with the medical model.
That's a really important point. Thank you for drawing that out. And so we expect our students to recognize the medical model and the limitations of that and how that can lead to bias in care, implicit bias. We want them to understand the social model of disability, recognizing the importance of accommodating disability so that people can live their full life. And also the World Health Organization developed an international classification of functioning that really tried to integrate both the medical model, so understanding the body systems and structures that may have something to do with disability and may not necessarily be tied to disability, but also recognizing the importance of accommodation and participation in order to fully understand the patient and to provide appropriate supports. And so that's kind of what our competency is recognizing different models of disability, including the International Classification of Functioning.
Do you speak about clinical skill development in the competencies?
We do.
Yep.
Yeah, a big part is on communication and how to accommodate patients with different communication preferences. We talk about skills for assessment and also clinical skills for providing healthcare. Yeah,
one of the things I think about is that when we're talking about teaching clinicians about healthcare for people with disabilities, it's not like we are teaching them how to take care of conditions that they don't already know how to take care of, like aspiration pneumonia, for instance, or bowel obstruction, or sepsis, or whatever it might be. But it's how these conditions may look different in people with intellectual and developmental disabilities, and maybe add some diagnostic skills to help them diagnose those conditions in a better way for people who may not use words to communicate, because sometimes they may show signs of illness through adverse behaviors, and then we misinterpret those a lot of times, and people get put on medicines that are treating the wrong thing. Yeah, so that clinical skill part of it is very important as well, I think. I completely agree. Yeah. And one thing I'll just clarify, the competencies are just a list of skills that the clinician needs to have. They don't provide the curricular content of how you're going to teach those skills, or those things are left to other professionals. And our hope is that the competencies will kind of scaffold the development of those training materials and make it easier to embed, because professional schools are driven by competencies. They have a set of competencies in medical education that they have to teach in order for the program to be accredited. And we structured our competencies to be easily embedded in that list. Now, if we could only get them embedded really in those lists, right? For nationally. That's right. Yeah. But certainly foundational work and important work that you've done to get it to that point. Yeah, absolutely. So, Susan, how did you get involved in this area of work? Yeah, it's a great question. I got a job as an undergraduate. I needed to work, and I got a position over the summer working in a program for kids with intellectual and developmental disabilities, and just really loved it. Continued working through the group home system, and felt passionate about helping this group. Yeah. And so I went to graduate school. My doctoral program was on intellectual and developmental disability psychology at The Ohio State University Nisonger Center. And from there, I recognized huge problems in mental health and mental health care for people with intellectual and developmental disabilities. And as I learned more, I recognized that also physical health was a huge disparity and barrier to care. And yeah, my interest kind of evolved from there. So as things are evolving and continue to evolve, what are some of the advances or exciting things or promising things that you're seeing right now in this field related to education of clinicians?
Yeah, that's a great question. I'm really excited about the commitment. The Centers for Disease Control and Prevention has expressed a real interest in training healthcare providers to provide better care to patients with disabilities, and they're investing in that, as well as PCORI, the PCOR Trust Fund, has committed funds for the same effort. Recently, the American Association of Medical Colleges did kind of a self-assessment and prioritized diversity and equity in their training, and in that work they recognized disability as an equity population.
That's actually great that they did, because a lot of times when people talk about diversity, equity, inclusion, they're not thinking about people with disabilities being included in that. So that's great that they did.
I know.
Yeah.
I know. I'm excited by that.
Yeah.
And I think, too, it's a great way, if you think about disability as a population identity, it's an easy bridge to include disability in the curriculum when you're talking about the same, as you mentioned before, you've got sepsis, there's but so many ways to treat sepsis, but it's important to consider when you're treating a patient who's from a minoritized racial and ethnic group or a lower socioeconomic status, the treatment recommendations may be similar, but it's important to bear in mind their culture and the way that you adapt your intervention to their life circumstances. And I think the same with disability.
So one observation that I've noted over the past few years is it seems like really in the past, I'd say 4 or 5 years, there has been more happening in terms of education of clinicians, or at least more initiatives. As you mentioned, CDC has an interest in it. I've seen more grants that are being or that are happening that are related to clinician education. Have you noted that as well?
I have too. Yeah, there's more and more publications.
It's kind of exciting, isn't it?
It's so exciting.
For those of us who've been wanting this for so long.
Yes.
Yeah, it's great to see that.
I agree.
Yeah, excellent. So, Susan, one of the things that I like to do is something that I call, actually cut that. Let me back up. All right, we'll do that later.
Okay.
All right, so here we go. So Susan, if there are people out there, say, in that have an interest in research or whatever, would there be some things that you might encourage them to do related to healthcare for people with intellectual and developmental disabilities?
Yes, I think another advancement in the last few years in disability research is a real pivot towards community engaged research and partnering with people who have disabilities in disability research. And I'm seeing more and more of that in intellectual and developmental disabilities. There was a session this morning. We're at the AAIDD conference.
We're at the AAIDD conference, American Association for Intellectual and Developmental Disabilities conference. Just a plug for the conference there.
Yeah, great conference.
Absolutely.
Wish you were here.
Yep.
The session this morning was all about how to partner with adults with intellectual and developmental disabilities as co-researchers in thinking about what's important, what research questions are important to ask, how to ask them, how to recruit participants, who needs to be recruited, what measures to take, and also how to interpret the findings and share the findings in a way that has the most impact and the most meaning. You presented at the conference today too, didn't you? I co-presented with my student, yes. Excellent. And what did you present about? Well, today was a really great session. Alice Baccarini, who's a she's a doctor. Congratulations to Alice. I've been talking to her for a while too, before she got her doctorate. Yeah, so she graduated a few weeks ago. Excellent. Yeah, her dissertation was looking at assumptions of intellectual and developmental disabilities that are held by physicians, and recognizing that a difference between attitudes and assumptions. And she defined assumption as being a belief that is held, never really questioned, but doesn't have proof. For example, that adults with intellectual disability can't contribute to their own healthcare decision making. Many physicians may believe that that's true. And because they believe that, it affects the quality of care that they provide to that patient. And it may, that's all I'll say. So she developed a measure of assumptions, and today she was talking about the relationship between those assumptions and other variables, like whether having more training on intellectual disability makes it more or less likely that you'll have a lot of negative assumptions, whether social capital or cultural capital, or having a close relationship with someone with ID, how those factors are related to assumptions.
And how are they?
It's complicated.
Yeah. In one sentence, no, I know that's a lot of research there, but I would think that if clinicians were taught more in medical school, they would probably have less assumptions?
Yes.
Or less negative assumptions?
Yeah.
Yeah.
That's true. Generally, that's true. We find that IDD training decreases the strength of negative assumptions about intellectual disability, especially for female doctors.
Now that's interesting.
I know.
I don't help me with that.
This is a huge question, and it may not be that interesting to viewers, but in a lot of research, we want to believe that education improves outcomes. If you train someone on disability, they'll be better able to provide quality health care. And we find a strong relationship for women, and for men, the relationship is more complicated.
I always thought women were more complicated.
See? Yeah. But one thing that we did find is for male physicians, they are more impacted by previous experience. And so I think one study I'd like to do is an intervention where we're providing training, but the training really is direct patient contact and experience with people with intellectual and developmental disability, and see if that mode of training has a better impact for both male and female.
I'm Dr. Craig Esquire, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. 3 things in 3 minutes that you'd like listeners to understand, to know about, or tips that you have that you think can improve the world related to people with intellectual and developmental disabilities.
Wow. Okay, putting me on the spot.
Yep.
I think number one has to be to listen to people with intellectual and developmental disabilities and their families, and to engage them in the work that you're doing, and to make sure that your goals align with their own goals for themselves. So whether you're a clinician or a researcher, I think that's got to be number one.
Great number one.
Thanks. Number two, I'm really committed to the future, the next generation of healthcare providers and researchers, and so I hope that we'll continue to invest in students and help them to engage with the field and to discover the joys of working with intellectual and developmental disabilities. And so I hope that we'll find ways to bring students to conferences and let them tag along with your work, so that the field is aging, is graying, as we've been saying for the last, I think, 10 years, before I started graying. And I think number two has to be invest in students and early career professionals.
Excellent.
Yeah.
You got a number three?
Number three, gosh, I think I'm going to be thinking about this tonight, wishing that I said something else. But what
That's
I'm
okay.
thinking
You can
about,
come back.
I'll come back. I'll ask to be on your next podcast.
Right.
Yeah. I think one area of my research is mental health for people with intellectual and developmental disabilities. I'm really concerned about the levels of stress and loneliness and poor self-esteem that we see in adults, and also barriers to getting an accurate diagnosis and quality treatment. And so I think number 3, along with listening to people with intellectual disability, being open and aware of mental health vulnerabilities and work to improve their lives and improve access to healthcare.
I think that's a great number 3.
I think they're so lonely. I've got to say.
Yeah. Susan, thank you so much for taking the time to be a part of this interview here. And more importantly, thank you for the incredible work that you do, and keep on doing it. And I'm going to keep on quoting it.
No, thank you.
Thank you so much.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.